opened the pharmacy in 1976, there was only one physician in this entire county, Dr. Thomas Lee Gwynn. His father had previously been a physician here, but he retired and subsequently passed away, and Dr. Gwynn was it. And I remember numerous occasions getting prescriptions from him off of grocery bags and napkins from the restaurant, and didn't matter, whatever he had close by, he'd write a prescription on because he knew we'd take it. Illegal today, but perfectly legal in those days. There was a new county manager here in the county, and I believe he was actually the first county manager. His name was Rick Honeycutt. We played tennis together some, and one day he came in and sat down and mentioned this rural health center bill that had passed a few years back, and wanted to know if I was interested in pursuing that matter with him, and he would try to do some of the legwork since I was here. So, long story short, we proceeded, and we got a grant to do some initial planning, and we were lucky enough to get a lady named Darkus from the University of North Carolina School of Public Health. We didn't have any money very much in those days, but so Darkus came to us for free and helped us put a plan together and devise something that we could take to the feds and say, here's what we got, here's what we want, and here's what we need. We put that plan together with her help, took it to the, she went with us, with me at that time. We took it to Atlanta, which was the regional office for FQHCs at that time, and lo and behold, they were crazy enough to give us up here in Caswell County a grant. So we were able to hire an administrator, and his name was Bob, and I cannot remember his last name, but he helped us with recruitment and putting policies together, and helped us put a board of directors together. And good guy. He had his master's in public health at that time. The first doctor we hired was Dr. Ron Friedman, and the first building we were in was across the street from my pharmacy here, was in the motor service building. Half of it was a motor service for parts, and the other half was a washerette, and it was a stairway up the middle. And so we had the entire upstairs as a doctor's office. We had Dr. Friedman for a while, and Dr. Friedman was an interesting human being, and I'm not sure where Dr. Friedman lived, but I think it was out of his car. He had a house, I'm sure, somewhere. But one morning we went over there. The nurse, secretary rather, came over and said, "The building's locked up and I can't get in." So we got in, and Dr. Friedman's office was cleaned out, closed up, and we never knew where he went or what happened to Dr. Friedman. So we began to recruit, and we got another couple of doctors, and then we were lucky enough to get another grant to build a small part of the building of the complex that's up there now. Mr. Eugene Aldridge actually, now I can't remember whether he actually donated the land or sold it to us for real cheap. It was one of the two. I'm thinking he donated the land. So we hired Quality Construction, Tony Smith and his group. We started recruiting. We were able to get Actually, we were able to get Dr. Broadhead, Eugene Broadhead. We were actually able to get a doctor named Dr. David Johnson. We were able to then, when they went on their ways, we were able to get Dr. Weeks and Dr. Todd Shapley Quinn. And my kind of goal at that time was to get the business going with FQHC monies and either sell or turn the practice over to those two. They were the kings that actually built that practice. Everybody loved them. A lot of people went to them, but they decided to actually move away. And we had a director at that time named Steve Shore. And Steve and I made many visits to Washington and to Atlanta to secure more monies that we could continue to grow the facility in size and in patient population and in staff. So we were able to do that, and then after that it kind of started going the way that no doctor was going to take it over or buy it there, because we provided way too many services and we were dependent to a certain extent in those days on federal monies. So then we had, I think Vicki Odom was the next chairman, the next administrator, I'm sorry. And after 18 years of me serving as president and chairman of the board, it was time for me to go my merry way or find another hobby. It was important for us to get this medical center for the future benefit of Caswell County, because we knew, and it happened, Dr. Gwynn was going to retire and we would be a medical desert, and nobody wanted that. So hence the reason we began the process of trying to obtain medical services for this county. When we first opened the doors, and somebody sent me a picture not too long ago, I think it was Tony Smith, of the day we put shovels in the ground. And boy, Tony Smith's gotten a lot older and I've stayed about the same. What it's become today has helped a lot of people in this county with the programs that they have, that they are working on. It has helped numerous patients that a private developed, privately owned corporation probably could not do. And I'm thankful that we have the facility that we have here, because personal touch from our physicians, from our nurses, from our physicians assistants and nurse practitioners. I'm grateful that the younger generation has the ability to use this facility, and I hope it continues for many years to come.